All right, so this is our first practice managers meeting of 2024. We're going to go ahead and get started with the agenda. We do have some welcomes and some staff updates that we'd like to share. We're going to do a very quick overview of some of the 2023 quality performance. Elizabeth Sharp is going to help us through that. We're going to do have a little discussion about 2024's quality measures and some of our communications around our incentive plan this year. We'll also do a quick update on upcoming incentive payments, and then we're hoping to have a little bit of an open discussion. I will share the revised 2024 meeting schedule for this meeting. It really is just the revision for today, but I'll make sure that everyone has updates for, has all of the meeting dates for 2024. So welcome. As always, please add your name and your practice to the chat so that we can capture that for your practice managers meeting attendance as part of the citizenship component for the PCP reward plan. Attending these meetings on behalf of your practice does count towards practice level citizenship. So if you attend 2 or more and you meet one other practice level component, then every provider in your practice that's eligible for the PCP reward plan gets citizenship for the year. So it is important that we do have that information. So I will say it again here and I will say it again later in the meeting, but great to have you this morning. Please add your name and your practice to the chat. So rolling right into staff updates, it has been a busy season since we last saw you all in December. I will start with one who is not listed here on this slide, Molly Parmenter. So I introduced Molly at our last meeting, but Molly was not here. She was actually on vacation. So it is nice to have you all here and able to see Molly. She started doing her rounds to your practices, but you'll be seeing a lot more of her in these spaces. Molly, is there anything you'd like to say or add to or share with the group?
Good morning. It's nice to see everybody. Looking forward to working with everybody. I know I've spoken with quite a few of you so far, but looking forward to meeting everybody else.
Thank you. Molly has been a really great addition, and I'm happy to have her at my side. So it's been a really good last couple months working with Molly. Also in staff updates, so we were excited to welcome 5 new members. You'll see 3 here and 2 on the next slide. We had Tanya Jo Nazra join our team as the new project director for clinical quality improvement. She is succeeding Kate Sharma in the role, and it will be focusing a lot on behavioral health integration as she gets started, working through collaborative care initiatives, some of the depression screening and follow-up work that we've been doing. So we're really excited to have Tanya here. Kevin Heacock has joined the pharmacy team as a clinical pharmacy specialist. He's embedded at an FF Thompson practice out east. So again, really happy to be expanding that team here under Bob's leadership. Jalen Kim joined our group as the provider data and systems coordinator. She is succeeding Cherie Turpin in this role, who had been helping us manage and maintain all of our provider data and their coming and goings of people as they leave practices. That role has been integral in just making sure that we are aware of when people are terming and just staying on top of those types of things. So Jay is getting up to speed in that space. I have started introducing some of you to Jay, but as we roll out, really thinking about how we can be helpful to you in maintaining that data and a proactive approach and thinking through how we might be valuable there and leveraging all of Jay's skills. So we're really happy to have her there. Before I move on, do any of these individuals leaders want to say a word or two? You don't have to, but I'll leave the floor open to you.
Sure, happy and excited to have another pharmacist join our team that can help out, with consults or if you have questions or, contribute to our pharmacy pearls.
Which remain a very highly sought after newsletter. So if your providers do not read Pharmacy Pearls, they're missing out, yeah, I'm telling you. All right. So moving right along, we still have 2 new staff to introduce. So Britt Gillett and Rachel Prince joined our care management and data coordination teams. So Brett is actually replacing our long tenured partner in Sam Barron. So really happy to have someone there working alongside Julia in the data coordination space. We also added Rachel Prince, a licensed social work care manager, to the pediatric social work team. So she is embedded at a couple practices. And so most of you who are working with, not most of you, all of you at this point who are working with Rachel have gotten a chance to meet her and start integrating her into your practice's workflows. So again, two really great additions there, and we're very excited to have them team. I don't see Danielle Robbins, so I am going to pop over, but if you are on the call and you want to say something, just shout it out. 10 seconds. All right, we'll move on. So this is where we're transitioning into 2023 quality performance. This is, I will caveat this, it's also on the slide, and Elizabeth will say this, but the view that we're getting ready to share with you is actually how we're thinking about showing 2024 quality performance. And so it is not the entire 2023 quality performance kind of view, but I will stop talking now and let the expert in this space take over.
Thank you, Jana. So as Jana mentioned, the way that we incentivize your providers in 2023 was based on that whole population. That's how we generally talk about quality measures. But AHP is interested in how we're performing on our different contracts. And so we thought we would share some of that information with you. I will note this is not the final. We're in the process of finalizing those 2023 scorecards like right now. But as of 12/26/2023, we had achieved 94 out of 100 points on our commercial contract, 98 out of 100 on Medicare, and 85 out of 100 on Medicaid. So really strong performance across the board. We're very pleased with that. Obviously, we have some additional work to do in the Medicaid space. Please know that's a focus for AHP. So as I mentioned, we pulled this on 12/26. The final scorecards include claims runout and those extra 5 days of clinical data. So there may be a little bit of movement. We would anticipate it really only going up. And the most notable change that I wanted to call out for everyone here is Excellus agreed to remove the medication-only patients from the diabetic measure denominators. So the HEDIS definition allowed patients to be included if they were prescribed a certain class of medications. And a lot of those medications are used for other things, not just for diabetic patients and diabetic treatment. So they are going to be taking out patients who don't have the medication plus a diagnosis of diabetes, which will remove some patients who are gaps from our denominators, basically what it boils down to. We're really pleased with that. They're going to be retroactively applying that in a manual way to 2023 performance. And they are going to be doing it in 2024 as well. We're just not yet sure if it's going to be something that's able to be updated all year long or if it's going to be a manual adjustment at the end of the year. So we will certainly keep you all posted about that. Does anyone have any questions before we jump into the 2024? Okay, well, I am here. Feel free to reach out, email, message me in the chat, whatever works.
Thank you, Elizabeth. All right, so moving into 2024, I think it's wise that we start with our provider-facing measures. So really, there's not a lot of movement here. As we've done in the past, we've tried to keep the measures that we show to our providers pretty consistent. What you will see is the addition of the DM Kidney Health measure. It is the first year that we're taking this measure on. So as we do with all new measures, the first year will be a pay for reporting. This measure is really focused on making sure that folks who are diagnosed with type 1, type 2 diabetes are also screened for chronic kidney disease. The importance there is that roughly 1 in 3 adults with diabetes do have CKD, and maybe as high as 90% of them are not aware that they do. And so that is what we will be doing, taking that measure on this year. We do still have the 4 child or pediatric measures, and then the other chronic disease and cancer screening measures that we have in addition to fall risk in the adult space. Any questions about quality measures before I go into the thick of the thing for 2024? No? All right. So there are going to be changes this year. And so in 2024, as you know, this is a transition year, but we will be measuring quality performance on the Excelis lines of business for this year. That means that we will be applying their population, the measures that are on those contracts, and also the thresholds associated with those measures on the contracts across the network. We will be reporting on that performance at the AHP network level for the Excelis Medicare, Medicaid, and commercial lines of business. This is a little different because, as Elizabeth mentioned, we have typically shared performance with you on a payer agnostic population, level. And this year, it's going to be a little different. The reason for that, this is a true transition year, and we do feel it's very important to continue to communicate some level of quality measure that people can feel confident in the accuracy around. So as we, had shared, we are transitioning from Arcadia to the new Health Catalyst population health management platform. And with that, practices are going to be, getting onto that system in a rolling basis. We have started that work with the really, really large systems and then some of our independent practices. And so as we do that, there's going to be varying levels of the type of clinical data that we're getting directly from the practice. And we're going to have some limited ability to communicate that based on provider attribution. So what we really do know is that we're going to have consistent Excelis population data. And so we want to be able to share that with you folks to the best of our ability. So that's really why we're making the changes for 2024. And in 2025, as folks, we get everybody up and running on Health Catalyst, we do expect to return to that population focus there. Does anyone have any questions about that? You guys are quiet. We're going to get through this really quick. So what does that mean, right? So we're going to be planning on sharing this information with you all quarterly. In similar views, there will be an Excelis commercial, an Excelis Medicare, an Excelis Medicaid scorecard that is created and shared with you on a quarterly basis, sharing performance at the network level. That does not mean that you won't have the ability to request more information on your individual practices, Excelis population. But we found that because there's, a lot of manual work that's going to go into this, and we do have those known limitations, that this seemed like the most equitable and efficient way to do this. We do plan to communicate this, across the network. That's going to be in network news, any email communications that might be relative, and then obviously sharing that in the adult and pediatric PCP committee spaces as well as this meeting. We are open to feedback. If there is another way that you think it would be valuable to have this information visualized and shared with you, please let us know. You can always reach out to myself, Molly, and your contacts here at AHP, and we'll certainly take that feedback into consideration. As I mentioned, we're not going to leave you out to the blind. So as we share those scorecards with you throughout the year, we have Elizabeth's been so gracious to dedicate some of Kevin Kelly's time to supporting this effort. So you'll be able to contact him with any questions relative to that sharing. So that's kind of how we see 2024 going. And right now we are in that kind of blackout period as we finish out the 2023 performance. But we will start sharing that with you all as we go forward into the spring and the summer and the sunshine. I'm tired. Okay. So I just talked about Health Catalyst. Here's a quick note on it. I didn't feel like we needed to go into a deep dive of where we are in that transition, but there are some things to know. We're making progress. We're really happy. I know Christy actually shared at a recent meeting that this has been a really, really pleasant implementation from where she sits, and I can't help but feel the same. I hear nothing but good things about the Health Catalyst team and the work that we're doing there collaboratively. So it's really exciting to be making this transition. We are in the process of loading claims data for our payer partners, so our really large Excelis and MVP contracts and then also loading in those health plan contracts that we do have as well. Making sure that that data is good because it does represent a lot of our work. We've already begun reaching out to some practices to start that transition from Arcadia to Health Catalyst. So if you have not heard, don't worry, we will not forget you. We have not forgotten you. And so we are just beginning that work there as well. We are also in the process of continuing that. You will get some more communications as we move through this about getting your practice up on Health Catalyst, any communications that might be necessary around data validation. Of course, one of the biggest reasons that we're moving to Health Catalyst is because we wanted to feel confident. We want you to feel confident in the data. So it really is important for us that as we get the new practices, transition to our new system, that everything that we're getting in there is accurate to your eyes and ours. So we'll definitely be doing a lot of work in that space with your teams. We are also thinking about how we're going to use this tool to really support the way that we communicate with our practices around quality, cost, all of those things. And so we are expecting some additional learning opportunities and different ways for the practices to really engage in this work as we build out that functionality. The only thing that we are asking from you in this moment across the board from everyone is just timely responses. I know that this can feel sometimes a bit like a hurry up and go kind of, initiative, and that is the nature of these types of projects, but timely response is really important to keeping this on track, not just for your practice, but for all of the practices. When we experience delays in one area, it does impact others. So we're really just looking for some timely responses to any requests that come from AHP and Health Catalyst on your end. And if you ever have any questions about this, please do not hesitate to reach out to your practice providers liaison or, Willie directly or anything like that. We are trying to save this time and have that dedicated really to guiding this implementation. So it's great if you can start with myself or Molly, but we will always triage as appropriate. So please don't hesitate to reach out with any questions. Before I move on to the next section, does anyone have any questions?
I just have one. This new program, when is the time frame that this is going to be rolled out? Is it going to be this year or like next month? What's the time frame on the Health Catalyst?
That's a good question, Joy. So we started this work actually late last year in October. And so we are expecting all of our practices to be up and running on Health Catalyst in early 2025, with the majority of them coming on board this year. So we are kind of doing this in stages with the bulks of the EMRs, really thinking through, we have lots of practices on MedEnt and then some on ECW. So really working through those big batches that we have early, and that work has begun. So there is a timeline for this, and it does look like we'll have most of our independent practices and system affiliates up in 2024.
Thank you. For Thompson practices, in November 1st of 2024, we're switching over to Epic. We're currently on MedEnt. I don't know if that causes any issues, just to make you aware.
Does not cause issues, and we are aware of it. It was actually something that came up in conversation before we had started with Health Catalyst, just being aware of that timeline that we had there. So Willie and the team in information management are taking into consideration, because we do have a few practices, not just at FF Thompson, but across the board, that are switching EMRs this year. So really thinking about how we're going to get historical data, and then for the feed, and then how we're going to transition to. So that is something that is being taken into consideration.
Oh, thank you very much.
No problem. Any other questions that folks might have?
Jane, if I could just interrupt real quick, just a reminder for everybody on the call to pop your name and practice name into the chat. I see a couple new boxes pop up, and so I'd like to give credit where credit's due.
Molly, see, Molly knows the importance of a interjected prompt, because there's always a new and we got them. Thank you for that. If there are no other questions, then we'll move right into the 2024 PCP reward plan. All right. So it talks a lot about a lot of change there. But what are we expecting to stay the same in 2020? Really, the overall structure of the PCP reward plan is expected to stay the same. We will have some subcomponents and initiatives that have changed just by nature of them no longer being relevant to the work that we're doing or being completed, or some of the limitations that we are expected to have this year. So we have made some minor changes there. You will still be able to see the other components except for quality measure in the PER. I know this has been a long run out for people getting on board and getting acquainted with that tool, but again, Molly and myself are here. And then Jay is also going to be supporting us, Jalen, in this space to help people get, up and running with the provider engagement report. One thing to note is as we transition to Health Catalyst and we do have access to new tools and new ways of showing things, we are thinking about how the PER could be more helpful to you all and different ways that we can improve that tool as we go forward. So again, any comments, questions, concerns, we are always willing and able to hear and take those into consideration. So like I said, I thought this would probably be the easiest way to show this at the highest level. The things that we have had traditionally, like in the 2023 reward plan, and then what we're planning on seeing in the 2024 reward plan. So the quality program, cost saving initiatives, and citizenship are really, that's the structure. And each of those things has some subcomponents. So in the quality program, that has traditionally been quality measures. And then we also have the depression screening and follow-up initiative. We do get the data for depression screening directly from the practice. And so as we transition and we know that we're going to have some different data coming in throughout the year from different places, we've decided to kind of rope depression screening into citizenship as a practice level engagement component. So you can work with Elizabeth and Tanya and that team there on some of the work because we do think it's important to keep that in our purview. But we just want to make sure that, again, we're showing you things that are accurate and that you can have faith. So this year's quality program is going to be strictly quality measures. In the cost saving initiative space, we wrapped up our work in the LARC. That was a multi-year initiative, ensuring that folks were getting education on reproductive health counseling. And so in 2024, LARC is all done. And so in this space, we really are going to be focusing on the pharmacy medication switches initiatives. Citizenship, that has remained the same. There are going to be provider and practice level components that you can achieve. And then I'm going to go through each of these subcomponents for the 2020. Pharmacy is staying the same. So Bob, in all of his wisdom, has decided that we will keep the pharmacy components the same as last year. Those 4 drug classes that will, influence if you have patients who are eligible for these medication switches. This will be working with them on switching to the less costly medication. There's also some work that you can do with the pharmacy team if you find that these medication switches are not clinically appropriate for your patients and you've tried these things before. You can always reach out to Bob and his team on those. Citizenship, how you qualify for citizenship and satisfy that component remains the same. You can either achieve it at the practice level by capturing 2 or more components there, or if it's not achieved at the practice level for all providers, we then do look at the provider level. So individual providers at the practice do have the ability to earn their components there. This is a longer list than you've seen. Really, the high level things have remained the same, but we've made some additions in the types of initiatives that might get you there. So as I mentioned before, we did pull in depression screening and follow-up. We've also added smart therapy education. Bob Adams and Paul Tremblay from Golisano Children's Hospital did smart therapy education at Clinical Grand Rounds, and it was very, very well received last year. And so they've been doing a little bit of a tour because people are really interested in this initiative. So we are including any work that you and your team do there with Paul, Bob, in that space as a practice level component. We are also launching geriatric support care this year. So if your practice is involved in that pilot or project, you will get credit at the practice level as well. One thing that we did include here is other AHP identified initiatives. This was a value add by Angelique Cohen because she was so wise to say, well, if we launch something new in 2024, they shouldn't not get credit for that just because it came out after we, created the incentive plan. So we will be allowing practices to capture components at the practice level for working on initiatives that have not yet launched, but may come out in 2024. As those things do occur, we will be sure to make sure that you all are aware. Yes, this does meet the criteria for practice level citizenship, and so your team will get credit for it as we go through. We've also thought it was very important. These last two bullets at the end, you will see, are swapped out for per engagement. And we do really have the bulk of the people who need to be engaged in the provider engagement report up on board. And so as we make enhancements, we'll expect that those people continue to be engaged. But really, we thought 2024, we want to make sure that we get Health Catalyst right. And so we want to be sure that we're incentivizing that because it's important to us and it'll be important to you as we go into the next iteration of AHP's population health endeavors. So practices who are slated for Health Catalyst implementation in 2024 will get credit for working on data validation, timely response, those types of things. We will, kind of work through that and make sure that we're sharing that information with you as we communicate with you this year. For practices who are not in this 2024 bucket for implementation, we still want to make sure that you get credit for doing the work here. We do expect to have educational opportunities for you and your team to learn about the system and the work that we're doing there. And so in 2024, you will get credit for attending any of those discussions and at the practice level. Does anyone have questions here?
Quick question from the chat from Patty
Yes.
Morning. How can we assist new practice leaders with more details for this slide?
Oh, absolutely. I would say reach out to Molly or myself. That's why we're here. We want to make sure that you all have information relative to the PCP reward plan, relative to all your activities at AHP. So I really think it's important that we do get to know your new practice leaders. We will share all of the slides from today there after this meeting. So if there is someone in particular that you want to get acquainted with this, just reach out and we can definitely do that.
And one more question on, is there is an update on the UR primary care practices and making care primary?
Yeah, so we do actually have confirmation from PCN that they will be doing Making Care Primary, that 10-year initiative from CMS. And then we do have a number of other independent practices who decided to sign up and were accepted for that project. We don't have a lot of details right now as they're still learning into where they're going to start per se. I think that question was from Sabrina over at IMB. So not a lot of new information there. Who is leading this at AHP? Sabrina, we don't really have a dedicated resource for MCP at AHP because this is not really a space that we're expecting to be playing in. But we are planning on helping to liaison between kind of the specialists because we do know there's some specialty expectations there in that space. But let me send you a note. We can connect and I can get some more information there and see what we're able to do to support. Sound good, Sabrina? Yes. Okay. Are there any other questions? Okay. So citizenship components at the individual level. So attending 2 or more AHP information sessions. So this used to just be attending clinical grand rounds. But what we found is throughout the year, we do end up hosting round tables and different, kind of lunchtime hour chats that we do think that you should be getting credit for. So in addition to clinical grand rounds, if you attend, anything that we do as a lunch and learn or something like that, we do want to give you credit for that at the individual level in 2024. This is really, again, looking at, this, you don't just attend clinical grand rounds and you don't just attend these meetings, but there's a whole host of activities that you and your providers do to show your relationship with AHP is strong. And so we just want to make sure that we're rewarding that. We will continue to ask that you subscribe to our email communications. Please don't unsubscribe. It's a really easy way to hit one of these components. It's also a really good way to make sure that you're getting clinical content like Pharmacy Pearls. So if you unsubscribe from one of our communications, you unsubscribe from all of them. And so again, just please don't unsubscribe. We also tend to get a lot of, oh, I didn't get that. And usually I find out that it's because you've unsubscribed in the previous year or previous life and thought it was just for one communication. We will continue to incent providers who are accepting new patients at the time that we calculate our reward plan. Again, when we talk through practice updates and the work that I'm hoping to be able to do with Jay this year, and we really want to make sure that we're getting all of this information proactively and it's maintained. So if you do have providers who are opening and closing their panels, please make sure that you're sharing that with us as we ask for practice updates on your clinicians. Serving on an AHP board or board committee. So that is obviously the AHP board, but we do have finance and membership committee that will allow you to get incentives there for citizenship. And then really the new thing here is for those practices who are eligible to participate in the Vatica Health Initiative, that's the risk coding program. And this is usually family medicine, internal medicine. This used to be 20% penetration, so completion of your targeted Vatica Health visits on just the Medicare line of business. Excellis did expand this program into Medicaid and over the years has expanded it over to commercial. So now that we've got a full year of kind of data on all of the lines of businesses behind us, we really do think that really looking at this as an average across all lines of business is most appropriate. So that's what we're going to be doing in 2024. Are there any questions about what I've talked about for 2024, quality measures, components for the reward plan, anything like that? Is there anything that the team from AHP would like to share relative to this?
I just wanted to share how amazing everyone has done in terms of quality. It's not easy to get the numbers that you showed, Jana. So a lot of shout out to the providers and their staff, including the managers. So thank you very much.
Anything else? Okay. Yeah, this has been, most of you on this call have been with us for many, many years. So I will say this on behalf of AHP, we are super grateful for your patience and collaboration with us. We have had a couple issues over the last year. And so we're really working hard this year to make sure that those don't continue to influence the work that we do here. So just really grateful for your continued patience, collaboration, and keeping us going in the right direction. So thank you. All right, something that's always really fun to talk about, upcoming incentive payments. So I talked to Jim last week, and we are expecting to be able to pay fourth quarter clinical integration for the Excellis population in April. We've paid quarters 1, 2, and 3 last year, and we will be paying the fourth quarter this year. We have already paid MVP for all of 2023. We did have some issues there that prevented us from paying that throughout the year. So I think while I was away in February, you all received your payments for MVP's full year clinical integration dollars. If you have any questions about that, just reach out. 2023 PCP reward plan payment. Again, we will be paying this in August, September, as we did last year for 2022. And so we'll continue to communicate about that as we get closer, but that is the expected timeline there. This is the open discussion section of the meeting. We always leave this up here, but we sometimes don't have enough time to truly have open discussion and to pick your brain about the things that might be going on and influencing your work at the practices. So before I do, ask for those items that you want to talk about today, I'm just going to leave a little note here. We're asking that you submit any topic ideas to Molly before our next meeting. If there's something that you know could be really helpful to talk about in this shared space with other practice managers in AHP, or if there's something that you're really interested in hearing, from AHP about, like making care primary, for instance, I think it's valuable for us to have that information ahead of time so that we can prepare and give you good information for what you're looking for. So I will look out. Molly's going to look out for any topic ideas that might come from you, but we're really hoping to make this, really fun. Call and response, have some discussion here. I know it's an early meeting, but it's nice to have some engagement and interaction. So anything we can do. With that, does anyone have anything they'd like to talk about this morning? Got really experienced practice managers. We've got the who's who of AHP here joining you this morning. So if there's anything on your brain, I think this is a good time to ask. I'll give the chat exactly 1 minute. So moving on to the very end of our program for today, if my slides will advance. Just an updated practice manager schedule. Of course, this meeting was rescheduled from earlier in the month due to my leave of absence, but we are back. I am back, and so we will be advancing, seeing you all again in June, on the morning of June 12th, again in September on the 18th, and then the last practice managers meeting of the year on December 3rd. These will continue to be from 8 a.m. to 9 a.m. We hope to see you there. If you have any questions, again, reach out. If there's anything that you'd like on the agenda, reach out, and we will continue to share updates on our various programs and initiatives as we go through. Things to remember. Yes, we are an AHP participating provider. This is important for your staff and your folks to know when people call and they are in those UR Health Plan, Highland Hospital Health Plans, or FF Thompson Health Plans. They want to know, is this practice in AHP? Because that's where they're going to get the best cost share for their benefits. So refer your patients to AHP specialists. If you need some help finding one, reach out, we can help. Admit patients to AHP hospitals and send patients to AHP imaging and labs. Again, this is how your patients get the best use of their benefits. And this is how we maintain our, we are able to say, we know we have good quality, good care, and for patients. So it's important to keep that care in network. For your practice, it is Monitor Arcadia right now, but again, that will be turning off in the future months. So continue to use what you have, use the provider engagement report to access other areas of quality and our incentive program. Attend this meeting throughout the year. Please accept, read, and share AHP communications with your teams and your clinical staff, and help providers connect with other AHP resources. We have a wealth of clinicians here who can help with consultations and such. And so we want to make sure that your providers have access to them as well. I will send this out, but contact information for the folks in provider relations, optimization, our clinical teams, our executive medical director, Angelique Cohen, any of the work that we're doing in Health Catalyst, Arcadia, information management, behavioral health pharmacy, and then some of those external contacts that we have in RMS Healthcare, Medline, and Atlantic Health Partners. With that being said, I'm going to stop sharing my slide. It has been a great morning with you all. Thank you all for being engaged and asking the questions that you asked today. I'm really happy to see you all this morning. But we will let you all go, and I will stay on just for a few minutes in case anybody needs anything. Thank you so much. Have a great day.